So a unique use of the KINVENT K-move would be to not only just take it for range of motion, but looking at an individual's knee flexion angle during a dynamic task. For we know that there's a perpetual underloading that occurs with the knee flexion angle in return to sport or return to activity following knee injury and or surgery. In this case, we can see that we've applied it to the wide balance, and I think it's significantly increased the sensitivity of the wide balance testing for the patients that I've looked at in a return to sport setting and with their decision making. So with the anterior reach, so we have 58 degrees on the left and 63 degrees of knee flexion on the right, which is an 8% difference. Even though there was a symmetrical reach difference, there was still a significant difference in regards to how far the individual reached. And then furthermore, we can see how that's been quantified over the course of their action here. So if we go ahead and hit the play button, we'll be able to look at the video as the individual reaches out. Okay, and so this is the sensor is on her stance leg, that is her right leg, and she achieves the greatest knee flexion angle there and then returns. Not only that, but the wonderful thing about the KINVENT is it also gives you a degree per second on average for how quickly the individual is moving. In this case, despite not getting, again, this is a healthy individual, despite not getting to the same knee flexion angle per se, the degrees per second were relatively comparable and actually slightly faster there on her left leg. But I've been able to pick up greater sensitivity with the knee flexion on sagittal plane knee flexion angle and have a more sensitive wide balance assessment in these cases using the K-move rather than just looking at the reach distance, because the reach distance oftentimes have shown to be within 90% and meeting the cut point, yet qualitatively we know that it's inadequate. And thanks to the K-move, I've been able to start to quantify these differences, which I know are more qualitative in their movement strategies, still trying to reduce their overall risk profile as they return to higher level sport and activity.